If you've ever walked out of your doctor's office feeling dismissed, rushed, or told, it's just stress, here's the hard truth. That wasn't just a bad appointment. That's the system doing exactly what it was designed to do: dismiss women. Women aren't crazy. We're being medically gaslit by a healthcare system that is built by men, funded by Big Pharma, and decades, and I mean decades behind on women's research. It wasn't until 1993 that women were even required to be included in clinical studies. And you know what? It shows. You know what's wild? I do this for a living. I teach women about hormones, metabolism, midlife health, and even I've had to jump through flaming hoops to get good care. Every single day, I talk to women who are exhausted, bloated, foggy, gaining weight for no reason at all. And the minute they finally muster up the courage to go to their doctor, they hear the same three words: your labs are normal. And I know you've been there too. If you've ever walked out of an appointment holding back tears or just rage because you know something's off, I see you, and I'm making this episode just for you. Because here's the truth: no one's coming to rescue us. The system isn't going to change fast enough. We're going to have to start thinking differently, outside the box, outside the exam room, and definitely outside the take this pill and call me later model of women's health. This is the Midlife Hormone Crisis podcast, and I'm your host, Jennifer Pickett, deprogrammed dietitian turned functional medicine health coach, certified midlife hormone specialist, and newly certified faster way to fat loss coach. And it's been a while since the last episode, and honestly, what's happened since then has only confirmed why this conversation is so needed. So if you've been missing the Midlife Hormone Crisis podcast, same, but we're back, and I am not easing in quietly. Today, we're diving right into why women's healthcare was never designed to serve us, and what you can do right now to stop getting dismissed and start getting results. So buckle up, my friend. You're about to see the system for what it really is. Dismissal is really the default. And you know what's wild? For a lot of women, the first time they ever truly felt dismissed by the healthcare system is not at menopause, way earlier than that. Think about it. A teenage girl has miserable periods and can't go to school 1 week a month. She finally gets in to see her doctor, and what's the solution? Birth control. End of discussion. She's told, there's a small toolbox. Here, take this birth control. Everything will be fine. No one asks why she's in that much pain. No one explains that her symptoms could be a clue to something deeper that's going on. Maybe it's endometriosis, PCOS, maybe nutrient deficiencies, inflammation. She is just handed a prescription and sent on her way. Fast forward 20 years, now she's in perimenopause, and the story hasn't changed. No progress has been made. She's anxious, exhausted, gaining weight, can't sleep, can't focus, and what does she hear? Oh, your labs are normal. What the hell does that mean? That phrase is the anthem, and I mean the anthem of dismissal. It tells women, I don't know what to do with you, so let's pretend that you're fine. And here's the thing. It's not that your doctor doesn't care. Most of them honestly, genuinely do. The problem is they were trained in a system that taught them how to diagnose and prescribe, not how to investigate root causes. Here's the other problem. They're working inside a structure that rewards speed, not depth. A 15-minute appointment, a quick diagnosis, a prescription, and out the door. That's why so many women end up walking out of their doctor's office with an antidepressant, an antacid, or a birth control pill instead of real answers. And oh my word, when it comes to hormones, the confusion just skyrockets. Ask 10 different doctors about hormone replacement therapy, and you're going to get 10 different answers. Everything ranging from, you don't need that, it's dangerous, to here's a low-dose patch, call me in a year. No education, no context, no discussion about different forms of hormone replacement therapy, dosages, or what's actually right for your body and how do you make that decision. So here we are, as women, we're left frustrated, scrolling TikTok at 2 o'clock in the morning, piecing together sound bites and wondering, who do I trust? I see this every single day with my clients. Brilliant, capable women who have spent years getting dismissed or doubting themselves because no one ever stopped to look deeper. And that's what I want you to understand first. Being dismissed is not your fault. It's not because you didn't explain yourself well enough or because you're too emotional. It's because this system was designed to patch problems, not prevent them. So if you've ever felt like you're shouting into the void, trying to get some help, I want you to hear this loud and clear. You are not crazy. You are not broken. You're just trying to get care in a system that was never designed for you. The first step to changing that is realizing you'll have to start thinking differently about where real answers come from. We have got to make this transition from dismissal to confusion. Because once you realize how dismissive that system really is, you start to understand why all of us are so very confused, especially when it comes to hormones. It's not just that we're being dismissed. We're being handed information that's either flat out wrong or decades outdated. So naturally, women are turning to social media, podcasts, their friends for answers because no one else is giving them any. And that's where the next layer of problems begins. Hormone replacement therapy. Those 3 words get thrown around like everybody's talking about the same thing, but I can promise you they are not. There is so much chaos and confusion around HRT. I hear this all the time. Well, my doctor mentioned hormone therapy, but I'm not sure what kind. Or someone else says, my friend's on pellets, maybe I should do that. Someone else, I think HRT causes cancer. That's what my doctor said. And yet someone else says, it saved my life. So where's the truth? Here's the reality. When someone says hormone replacement therapy, HRT, it can really mean wildly different things depending on who you're talking to. You can have a doctor that says hormone replacement therapy and they literally mean a birth control pill. Another might mean a patch or cream. Someone else might be referring to bioidentical hormone replacement therapy with patches or creams. Someone else might be referring to bioidentical hormone replacement therapy with regard to pellets. That's why women are spinning in confusion. We're using the same term to describe completely different modalities, different treatments, different doses, different delivery methods, and different philosophies of care. Let me add to that. Most doctors are not educated in menopause medicine. In fact, a Mayo Clinic survey, a Mayo Clinic proceedings survey published in that journal found that only 7% of physicians surveyed felt adequately trained to help women through menopause. 7%. So when you ask your doctor about hormone replacement therapy, many doctors just kind of default to that fear-based, soundbite that they were taught decades ago. And that usually traces back to that very much botched Women's Health Initiative study. And that literally sent a shockwave of misinformation through women's health care that we have not recovered from. That study got so much wrong. And yet, 20 years later, that shadow still hangs over every single exam room. The result? We're trying to make some of the most important health decisions of our life based on conflicting advice, internet chatter, and half-truths. And here's what breaks my heart. And you can hear the passion in my voice because I hear you. I hear your stories. I hear your nightmares, and I've experienced it myself. We are making hormone decisions out of desperation instead of education. We're like, just give me something. Please help me. Women are so tired of feeling awful that they'll take anything that promises relief without realizing that the wrong approach can actually backfire. Sometimes you don't realize that until years down the road. There's consequences to heart health, bone density, brain function, overall longevity. It's not their fault. They just don't know what they don't know. So because no one is teaching women how to evaluate their options, how to test properly, or how to build a plan that's personalized for their body. That's why I've been so passionate about this, about helping women get educated long before they have a conversation with their doctor. How are you even going to know if your doctor knows what they're talking about? You've got to stop making reactive decisions and start making informed ones. That's not going to come about as a result of a soundbite, a TikTok video, or an Instagram reel. When you understand what your testing options are, when you truly understand how estrogen, progesterone, testosterone work together and how all of these systems work together, you start to understand what optimization really means. And that's when everything changes. I will tell you from personal experience, hormone replacement therapy can be absolutely life-changing, but only when it's done right. And that starts with education, not simple sound bites. Before we wrap this up, I want to say this. We've got two broken extremes, okay? Neither traditional medicine nor functional medicine has nailed women's health, okay? We've been failed literally across the board. And I'm such a massive fan of functional medicine. But where traditional medicine tends to dismiss and undereducate, literally just write a prescription, send you out the door, functional medicine, while it is definitely root cause focus, can sometimes overcomplicate and definitely overcharge. And what I've seen, even within functional medicine, it's this split world. Some practitioners simply tell women, okay, eat clean, take a few supplements, keep exercising. Then you have other practitioners that jump straight to pellet therapy. And oftentimes, none of these have the specialized hormone training that midlife women truly need. And honestly, pellet therapy, that's become like the new form of dismissal. It's this one-size-fits-all, let's shove this in her booty and keep her quiet for 6 months approach. Easy for the provider. Is it the best thing for you? So that's a big topic. We will dig into that deeper in an upcoming episode. But for now, let me say this. Women deserve better care than convenience medicine dressed up like hormone care. And I've seen both sides. I've lived in both worlds. And trust me, neither system alone has the full answer. Which means if you want real lasting results, you're going to have to start thinking differently about how you approach your care. We got to think out of the box. And thinking differently starts with understanding you're the CEO of your own health. This is not just a matter of finding the right doctor and hoping for the best that they're going to help take care of your needs. You can't outsource your well-being to a 15-minute appointment or an influencer reel. You need, let me rephrase that, you deserve education. You deserve testing. You deserve a personalized plan that actually fits your body. Not your neighbors, not your friends, not your sister, and definitely not the one-size-fits-all approach from this broken system. This is the level of care that you deserve, and you know what, my friend? You're not getting it. That's why I created my program, to bridge that gap. Inside the Hormone Huddle, we're combining hormone testing, blood work, root cause strategies, so you can finally understand what's going on and create a plan that works for you. No, it's not about chasing quick fixes or waiting until you're just absolutely miserable and you're just desperate for an answer. It's about taking ownership now, long before things start to spiral. So here's my challenge for you after this episode. Start thinking out of the box. This will not look the way you thought it would look, okay? You're going to have to start asking better questions and stop settling for normal labs when you know you don't feel normal. This will look differently for you. So shifting your thinking is where it starts. As we wrap up, I know the holidays are here. Life gets busy. It gets crazy. We're trying to take care of all the things and all the people, right? And it's really easy to tell yourself, okay, I will just power through and then I will deal with this in January. But let's be honest, haven't we always done this? That's how another year slips by while you're still feeling stuck and miserable and taking it out on your family. And by the way, things keep getting worse. So if you're ready for real answers, not guesses, not Google rabbit holes, now is the time. I only have a few spots left inside the Hormone Huddle. My personalized comprehensive hormone program. This is where we dig into that functional testing, really uncover what's going on with you, discuss all of your options for hormone replacement therapy, whether that's a good option. You are totally educated and empowered. We create a plan that actually works for you and your body. The kind of care that you deserve. But what you need to do first is book an insight call. The link is in the show notes. We will talk through your symptoms, what's going on with you, a little bit of your history, your goals, and we'll see if one of those spots within the Hormone Huddle is for you. Let's make this season where you actually recognize yourself again. More energy, a body that's finally working with you and not against you. Can you imagine what that would feel like? Stick with me, friend. This is Midlife Hormone Crisis, where we ditch the dismissal, demand better care, and finally get the answers we deserve. Until next time, keep listening to your body. It's way smarter than the broken system.